Welcome to Childcare Licensing's Independent Training Series. This training is an additional required topic. My name is Kat Martinez, and I'm a trainer with Childcare Licensing. This training is about 10 minutes long. In this section, we'll talk about pediatric, CPR, and first aid. This is not a replacement from a certification course. It is intended only as a review and for your information. Get certified. To learn CPR properly, take an accredited first aid training course, including CPR and how to use an automated external defibrillator, or an AED. If you are untrained and have immediate access to a phone, call 911 before beginning CPR. The dispatcher can instruct you in the proper procedures until help arrives. Before starting CPR, check. Is the environment safe for the person? Is the person conscious or unconscious? If the person appears unconscious, tap or shake his or her shoulder and ask loudly, "Are you okay?" If the person doesn't respond and two people are available, have one person call 911 or the local emergency number and get the AED, and have the other person begin CPR. If you are alone and have immediate access to a telephone, call 911 or your local emergency number before beginning CPR. Get the AED if one is available. As soon as an AED is available, deliver one shock if instructed by the device. Then begin CPR. If you care for children under 4 weeks of age, please get certified. The procedures for newborn infant CPR are slightly different than those for children 4 weeks to 1 year old. But here are the CPR procedures for children of that age, 4 weeks to 1 year old. Compressions. Place the baby on their back on a firm, flat surface, such as a table. The floor or ground also will do. Imagine a horizontal line drawn between the baby's nipples. Place 2 fingers of one hand just below this line in the center of the chest. Gently compress the chest about 1.5 inches. Count aloud as you pump in a fairly rapid rhythm. You should pump at a rate of 100 to 120 compressions a minute. The speed of compressions that we're looking for is to the tune of "Staying Alive" by the Bee Gees, "Dancing Queen" by ABBA, or "Celia" by Simon and Garfunkel. Check them out if you need to hear the tempo. Airway. After 30 compressions, gently tip the head back by lifting the chin with one hand and pushing down on the forehead with the other hand. Breathing. Cover the baby's mouth and nose with your mouth. Prepare to give 2 rescue breaths. Use the strength of your cheeks to deliver gentle puffs of air instead of deep breaths from your lungs. To slowly breathe into the baby's mouth 1 time, taking 1 second for the breath. Watch to see if the baby's chest rises. If it does, give a second rescue breath. If the chest does not rise, repeat the head tilt, chin lift maneuver, and then give the second breath. If the baby's chest still doesn't rise, continue chest compressions. Give 2 breaths after every 30 chest compressions. Perform CPR for about 2 minutes before calling for help, unless someone else can make the call while you attend to the infant. Next up, let's talk about CPR for children 1 year old until puberty. Compressions. Put the child on their back on a firm surface. Kneel next to the child's neck and shoulders. Use 2 hands or only 1 hand if the child is very small. To perform chest compressions, press straight down on the chest about 2 inches. If the child is an adolescent, push straight down on the chest at least 2 inches, but not greater than 2.4 inches. Push hard at a rate of 100 to 120 compressions a minute. If you haven't been trained in CPR, continue chest compressions until there are signs of movement or until emergency medical personnel take over. If you have been trained in CPR, go on to opening the airway and rescue breathing. Airway. If you're trained in CPR and you've performed 30 chest compressions, open the child's airway using the head tilt chin lift maneuver. Put your palm on the child's forehead and gently tilt the head back. Then with the other hand, gently lift the chin forward to open the airway. Breathing. 30 compressions followed by 2 breaths equals 1 cycle. Pinch the nostrils shut for mouth-to-mouth breathing and cover the child's mouth with yours, making a seal. Prepare to give 2 rescue breaths. Give the first rescue breath, lasting 1 second, and watch to see if the chest rises. If it does rise, give the second breath. If the chest does not rise, repeat the head tilt, chin lift maneuver, and then give the second breath. Be careful not to provide too many breaths or to breathe with too much force. After the 2 breaths, immediately begin the next cycle of compressions and breaths. As soon as an AED is available, apply it and follow the prompts. Use pediatric pads if available for children up to the age of 8. If pediatric pads aren't available, use adult pads. Administer 1 shock, then resume CPR, starting with chest compressions for 2 more minutes before administering a second shock. Continue CPR until help arrives. First aid. Get certified. First aid. Preserve life. Your first aim is to preserve life by carrying out emergency first aid procedures. Preserving life should always be the overall aim of all first aiders. Remember, this includes your own life. You should never put yourself or others in danger. Prevent deterioration. The second aim of first aid is to prevent the injured individual's condition from deteriorating or worsening. For example, ask a person with a broken limb to stay still and place padding around the injury to prevent the fracture from moving and causing further injury or pain. Promote recovery. Promote recovery by arranging prompt emergency medical help. Simple first aid can significantly affect the long-term recovery of an injury. For example, quickly cooling a burn will reduce the risk of long-term scarring and will encourage early healing. Choking. The danger signs of true choking include inability to cry or make much sound, weak, ineffective coughing, soft or high-pitched sounds while inhaling, difficulty breathing, ribs and chest retract, bluish skin color, loss of consciousness if blockage is not cleared. Not choking. Stay calm. Gagging. It's a natural reflex to defend against choking. Do not intervene when a child is gagging. Coughing, or loud noises that indicate the airway is not blocked. Give the child a chance to work through it on their own. Vomiting may result from gagging and coughing and is normal defense against choking. Do not do a finger sweep, which may cause food to block the airway. Chest thrusts. Chest thrusts for infants who are truly choking. Do not perform these steps if the infant is coughing forcefully or has a strong cry. In those cases, they can dislodge the object on their own. But if they're truly choking, lay the infant face down along your forearm. Use your thigh or lap for support. Hold the infant's chest in your hand and jaw with your fingers. Point the infant's head downward, lower than the body. Give up to 5 quick, forceful blows between the infant's shoulder blades. Use the heel of your free hand. And get certified in both CPR and first aid. Thank you for taking this training review. If you have questions, please reach out to me, Kat Martinez, or Charlotte Woodward, and have a great day.